light of the recent passing of a celebrity, Jackie O, also known as Jacqueline Smith, she died in Miami from complications with plastic surgery. Although the cause of her death has not yet been revealed, prior to her death, she actually posted about her visit to Miami on her social media. And the post has since been deleted, but apparently it said, "Getting ready for my mommy makeover with Dr. Zach. Stay tuned to my YouTube for a full reveal." So, for those who don't know, and I didn't know until this happened, Jackie O was on Nick Cannon's Wild 'N Out show for a number of years and then pursued other interests, a makeup line, real estate, etc. But she was only 32 years old. She was the longtime partner of DC Youngfly, who is a regular cast member also on Wild 'N Out. And they have three beautiful young children together. And this truly touched my heart because I have three young children and now they're left without a mother. But first, my condolences to her family and friends. But this story is becoming all too common. So today, I'm actually covering what you need to know before a mommy makeover. And so, one of the things I want to say is if you're new to my channel, welcome. I'm Dr. Natasha Ramantal, also known as the Medical Tourism RN. I'm not a physician. I am a doctoral trained registered nurse who's worked in the emergency department and the post anesthesia care unit for a number of years. But on my channel, I cover all aspects of medical tourism for Black women if they decide to seek healthcare or treatment abroad for anything from cosmetic surgery to cancer, fertility treatment. But Black women, I want to make sure that you make the most informed decisions about your healthcare so that you have the best outcomes and experience. So if this is of interest to you, make sure you subscribe to my channel and also hit the notification bell so you're notified when I post a new video. Now, before I get into what you need to know about a mommy makeover, let's just talk about what you need to do before you even decide to do it, right? You need to do your research. And I'm always talking to you guys about your research about the physician or surgeon, but also about the facility where you're going to have this done. A simple Google search, and all of us can have a PhD in Google, just shows, and I'm going to use Jackie O's situation. Dr. Zach, who she had, Dr. Zachary Oka, that's his name. But Dr. Zach had several negative reviews. I mean, 2 stars out of 5 in many cases, with comments like, "He mutilated me," or comments of botched procedures like, "He left my hips lopsided," and so much more. But someone even stated that they read Dr. Zach's reviews since Jackie O has passed away. And she said he has 6 reviews, 2 are positive, and the others are 1 star reviews. Obviously, more has come out about Dr. Zach since Jackie O's death. You know, a lot of things are still developing and a lot of things tend to come to light later. But something that's significant outside of the reviews that was interesting, and you could find this in Google, is that he seemed to have a history of suing his patients, and he was suing them for leaving bad reviews. All right. So I know of 2 cases that I read about where he sued 2 patients for bad reviews. He sued them each for $30,000 and they were separate patients. But one patient who left the comment that he mutilated me, Dr. Zach's position obviously is that he claims that that's false, but he ended up dismissing his lawsuit less than 6 months later. So he didn't pursue it all the way through. Don't know why, but you guys can guess. The other patient, that lawsuit that he filed against the patient for the same amount of money, $30,000, it was after a patient claimed in her review that happy patients of Dr. Zach's don't exist. All right. Of course, he claimed again those remarks were false, but he dismissed that lawsuit as well. And both of these were in 2021. So there's a timeline there. You can see that he has a history. There's something suspicious when a physician is consistently suing their own patients, and it's for bad reviews. It seems to be a pattern with this particular surgeon. I'm not going to spend this video on additional details surrounding this situation, but I wanted to highlight the red flags for you simply because I want you to do your research about your physicians and your facilities, and I cannot make it any more clear because there were several red flags here. There were a number of negative reviews on this surgeon all over the internet. You know, I share information on how to research this information in addition to Google, in my interview with Roshida Dow that I did a couple months back. If you haven't seen it, please watch it. I put the link in the description, I essentially name a number of different places where you can do this type of research on the physicians, on the facilities, making sure that they have the proper accreditation and certification and that they consistently are keeping up with it. Okay. So if you want to have cosmetic surgery, no judgments, go ahead, but you need to do your research beyond just before and after pics, which honestly may or may not be the surgeon's actual pics, right? So I included those other websites in the description as well, where you can look up ratings on physicians. Those are kind of limited to the US though. So outside of the US, you're going to have to do your due diligence with the other resources that I provided for you. All right, so let's get into what you need to know before having a mommy makeover. First of all, what is a mommy makeover? A mommy makeover is essentially a term that's used to describe any combination of a few cosmetic procedures, including a tummy tuck, breast augmentation, and that can be inclusive of breast implants or breast reduction in some cases, breast lift, liposuction, and also vaginal rejuvenation surgery. But traditionally, the standard mommy makeover actually includes typically the abdomen and the breasts, and it's usually a tummy tuck and or liposuction or some type of breast augmentation or breast lift. Because after a woman gives birth, obviously her breasts and her abdomen are dramatically affected by pregnancy and birth, hence the name mommy makeover. Okay, but there's no standard mommy makeover. A mommy makeover is not a one size fits all procedure. Who would be a good candidate for a mommy makeover? Any woman in overall good health who has completed her childbearing, right? If you intend to have more children in the near future, it's better to just wait to not have a mommy makeover, especially on the tummy tuck, because additional pregnancies are possible following a tummy tuck, but the final result may not be as good if the tissues are stretched again with another pregnancy. So it makes sense to be completed with the number of children that you're having. I'm not going to spend too much time on cost, but mommy makeovers, and I'm only speaking about the US here, generally cost anywhere between $9,000 and $20,000 or more in the US. And this is a wide range in price difference because, again, the mommy makeover is really a combination of several different surgeries and it's personalized for each patient. So you may want more, may want less, depending on what your desire is for your body. And again, in this video, I will not be getting into like specifics about countries to have a mommy makeover in and the cost. I can cover that in another video. But mommy makeovers can be done at one time, all at one time, or it can be done in one or two stages, depending on how many areas actually need to be addressed. So it's important that you are specific about your post-baby body goals so that your surgeon can actually recommend the most appropriate procedures for you. And honestly, it's best to do that ahead of time because if you don't have to go under the knife and anesthesia a second time unnecessarily, it's to your benefit. Okay. So, how should you prepare for a mommy makeover? The best way to prepare for a mommy makeover is to understand why you're even having the surgery, what exactly will be performed, and what your results are likely to be. Okay. So, also, if there are medical issues such as high blood pressure or diabetes, which Black women have higher rates of both compared to their white counterparts, these should be well controlled prior to surgery. And I don't mean controlled only for a few weeks before the surgery. It should be consistently controlled before you decide to even have this type of surgery done. Also, you want to get lab testing and a medical evaluation. This includes your health and surgical history, your medical history, and a physical exam. So that includes any complaints that you may have. If you're not feeling well, you notice something different, don't take anything lightly. Share everything. It's better to overshare than to undershare, because these things mean something to a surgeon who doesn't have a regular relationship with you, a consistent relationship, unlike maybe your primary care or a specialist would. So overshare, write it down so you can even remember it and go into all your meetings with the surgeon so that you don't forget. Okay. But any complaints, details of present illness, relevant past history, any chronic illnesses or autoimmune disorders, even if you're anemic, those types of things, medications, and I mean prescriptions, over the counter, vitamins, supplements, and also herbal remedies. Okay, that's really important, and I'll get into why in a minute. But also drug and alcohol use, tobacco or smoking, any allergies, and they also do an assessment of your body system, which is inclusive of your heart and lungs, because those are key, especially when you're going to have any major surgery. Okay. Take certain medications or adjust your current medications. Obviously, this is not something you would do if you're on an existing medication. If it's a prescription, you may have to temporarily stop taking it, or the physician would have to adjust your dosage. So you should be making sure that all of your physicians are aware that you're going to have a mommy makeover when, so that they can all be in alignment with what you should be either taking more or less of, or stopping altogether, and how soon you should stop it and how soon you should restart taking it post surgery. Okay, but the surgeon will help determine this upon your exam as well. Now, over the counter and herbal remedies, you need to be very careful about. Okay, many things that seem harmless because they're natural can still have detrimental effects when undergoing surgical procedures, and I'll go into that in a minute. But I also want to make sure, if you are a smoker, and I don't only mean tobacco, if you are a smoker, you are going to want to stop smoking at least 4 to 6 weeks. 6 weeks would be more ideal before your surgery, and remain smoke free up to 4 to 6 weeks after. Again, 6 weeks is more ideal. But if you smoke, you are putting yourself at a higher risk of surgical complications. Okay. Um, Basically what happens is, before your if you're smoking before your surgery and after, it can actually decrease your rate of wound complications by 50%. So if you don't quit smoking before surgery, you may be at a higher risk for things like your infections, which is a huge deal, and it's preventable, right? But since oxygen is the main source for healing your wounds, that's why it's important that you stop smoking. Okay, so even if you quit 24 hours before the surgery, that can actually increase the amount of oxygen in your body. But to have optimal results, 6 weeks before and 6 weeks after, remain smoke free. Okay. Also, you're going to want to avoid taking aspirin and anti inflammatory drugs and herbal supplements, as they can increase bleeding. For example, and this is what I wanted to get into, ginger. Many people drink ginger tea to help alleviate gas and upset stomach, or even nausea. It's been known to help with that. I drink it all the time. However, ginger is naturally a blood thinner. So this is something that could cause harm depending on the nature of your surgery. And I was always taught that for herbal remedies, there are the 3 Gs. There's garlic, ginger, and ginkgo biloba. And it's important to avoid if you're going to have a surgical procedure. Ginger, again, is a natural blood thinner, but garlic, that actually acts as a blood thinner. Too much garlic can actually increase your risk during and after surgery. It may also interact with blood thinning medications if you're given that. And then people with ulcers or thyroid problems should ask their doctors before taking garlic, because of the effects that it has. And then ginkgo biloba, that's something that a lot of people use it because it contains powerful antioxidants. It can help reduce inflammation. It improves circulation and heart health, and so much more. But the ginkgo may actually raise the risk of bleeding, especially if you take the blood thinners that I mentioned before, and they can interfere with the effectiveness of other drugs that are taken to treat anxiety, like Xanax. Okay, so that's important. Make sure that you share herbal remedies, over the counter minerals, supplements, whatever you're using. Don't just think, when we're talking about medications, prescriptions. Okay, you have to think beyond that. If there's anything that you eat or drink that you take regularly for whatever reason, share it. Okay. And then plan for your recovery. And this is critical. Okay. It's critically important to achieve optimal outcomes for your surgery, the way you adhere to the treatment plan during recovery. So it's helpful to have friends and family available to assist you in your care of yourself. And also, if you have children with you, depending on where you're having your surgery, I don't know if it'll be in your home, town, state, country, you need to have help. Okay. Recovery can range anywhere from 1 to 4 weeks for a mommy makeover. And in most cases, and patients are actually asked to refrain from heavy lifting for 1 month. A mommy makeover is painful, You can expect bruising for 1 to 3 weeks. You can expect swelling for 2 to 8 weeks, and soreness and tenderness for several weeks post surgery. Okay. So while complications are actually rare, the most common complication after a cosmetic procedure is actually infection at the incision sites. And that could be for a number of reasons. But what we found is that a number of people will do too much too early because they feel that they can. Okay. You need to rest as much as possible and follow all the doctor's orders to a T. If your mommy makeover includes a tummy tuck, keep in mind it requires considerable downtime. The worst days after tummy tuck typically will be the first 1 to 3 days. Okay. You may experience discomfort, bloating, pressure, swelling, but these symptoms are actually normal and they do resolve themselves. I am going to briefly discuss tummy tucks and liposuction and some differences in this video. So I'll get to that in a minute. But you should expect to be also at a stable weight before your tummy tuck. You should not gain or lose a significant amount of weight before your tummy tuck. Significant over 20 pounds, okay, depending on when you have actually decided to schedule it, okay? But some recommend being no more, some physicians actually recommend being no more than 25 pounds over your ideal goal weight. So again, it differs from surgeon to surgeon. So and your health and your health history is like a fingerprint. It's unique to you. So whatever your doctor says, you should go with that. But while there are no standard weight requirements for a tummy tuck, there are some standard guidelines that most cosmetic surgeons follow. If your BMI is not over 35 and you are within about 30% of your ideal weight and in overall good health, you should be a viable candidate for a plus size tummy tuck surgery. And that's plus size, right? So, but most surgeons also agree that you should at least wait 6 months after giving birth before considering a mommy makeover. So if you know maybe it's your last child that you're going to have and you decide, okay, I want to do something, try to wait 6 months or more after you've given birth for your body to adjust. You've just been through one of the most life-changing events on your body and in your life, right? So be patient, okay? Also keep in mind, tummy tucks will leave a permanent scar. Now, depending on your surgeon, it should not be anything outrageous, but with a tummy tuck, surgical drains will be placed for the first week or two, and full healing actually can take up to a year. And by that, I mean, it's not similar to what happens immediately post-op. What we mean is you will feel the effects and the tightness in your muscles and your abdomen. You'll feel all of that and nerves going and coming and changing and all of those things transitioning over that period of a year when I say that. Okay. But once the incisions are fully healed, your plastic surgeon will instruct you as to how to minimize the scars and help to fade them over time. Okay. And that's something that is pretty common. There are a number of things that are out there that you could use for that. Now, whether you're contemplating a mommy makeover, like the full package, or you just want to undergo only a tummy tuck, you'll be relieved to know, for those of you who have had a C-section, you'll be relieved to know that any pain from this cosmetic procedure is far less than what's experienced with a C-section. Okay, so I'm told. I have not gone through that myself. Now, many people ask how much weight you can lose with a mommy makeover. Mommy makeovers, let me be clear, they're not weight loss procedures. They are not. Depending on which procedures you choose for your mommy makeover, you could lose anywhere from 5 to 7 pounds. Okay, 5 to 7 pounds. However, some may lose more if they have a significant amount of loose skin that will actually be tightened with a tummy tuck. So some women can expect to go also down one size or two sizes after skin tightening and fat removal, while others may drop more. So it really depends, okay? But mommy makeovers can actually help your body appear slimmer by removing excess skin, tightening those ab muscles, and also sculpting your body. So by combining multiple plastic surgery procedures into one surgical setting, women can achieve a more flattering or appearance, which is more in a fit appearance, which is what most women desire with the procedure anyway. With tummy tucks, your abdominal muscles are tightened and they're strengthened in the midsection, and it also narrows that waist, so you have that Coca-Cola bottle shape that everybody desires. But also, the excess lower abdominal skin with the stretch marks is removed in a tummy tuck. So the tummy tuck is actually very useful when exercise and diet have actually failed to tighten your abdominal muscles. However, a tummy tuck is not really designed to make you look thinner, if that makes sense. Okay. The tummy tuck improves the muscle profile of your abdomen, which in turn can have an effect of making you look more fit and more toned. Who wouldn't want that, right? So what happens if you actually lose weight after a tummy tuck? Because some people, it inspires them to get out there and to start doing regular exercise. For example, if someone who has had a tummy tuck loses 10, 20, or even 30 pounds after their procedure, their skin may shrink nicely enough to maintain their tummy tuck results. In fact, it may actually help the skin shrink comfortably around the abdominal area and enhance your new contours. However, losing more than this beyond that 30 pounds, even 30 pounds, you may see this, but losing more than that may result in loose and excess skin again after the surgery. So you want to be mindful of when you do this. If you find that you need to lose more than 30 pounds now, you should try and do that pre this tummy tuck or mommy makeover. Okay. Try to lose as much as you can before you even go to see a doctor about a consultation. All right. Now, during body contouring procedures like a tummy tuck, what happens is your fat cells are actually eliminated from the body and they cannot return. Okay. Because of this, patients may gain weight in other places like your butt, your legs, your arms, your breast. Okay. Now, can your stomach get fat again after a tummy tuck? While minor weight fluctuations among adults are normal, significant weight gain and significant here, I'm only talking about 10 pounds. Generally, over 10 pounds after a tummy tuck can lead to the accumulation of excess fat in the stomach again. Okay, so you are going to need to be really careful after this procedure. In addition, when we talk about that weight, stretch marks and loose skin can also return, all of which can impact your tummy tuck results. So if you decide to have a tummy tuck or a mommy makeover, make sure you are doing what's necessary to maintain your desired look. Okay. Now, when we talk about liposuction, which is completely different from the tummy tuck, what happens with liposuction is when the fat cells are destroyed, as they are during this laser liposuction, they do not regenerate. Okay. It's like they kill the fat cells, can't come back. All right. However, in that area that they are treating. However, it is possible for the remaining fat cells to produce higher amounts of this lipid fatty acid. And that results in the appearance that the fat has actually come back after undergoing liposuction. So since liposuction permanently removes fat cells from that particular area and the fat cells do not grow back and they don't duplicate in that area where the liposuction has been done, you need to be really careful, because I have seen a number of patients who have had liposuction, really happy with the results, but then they're eating like crazy, not changing their diet, and just think, okay, I can do anything I want. And fat starts to accumulate in other areas where they never had a problem before. It might be their face, their cheeks, their neck. I mean, it goes anywhere. And unfortunately, it is possible for that fat to return after liposuction, but this is only if you allow it to come back. Just being realistic, okay? So a diet after a mommy makeover. What should you eat? How should you eat after a mommy makeover? So immediately, like post-surgery, your post-surgery diet should actually contain foods with lots of vitamins and minerals to help decrease the risk of infection and also speed up your healing process. So fruits, vegetables. If you are able to consume dairy, yogurt is good for the protein. Lean proteins and whole grains should make up most of your post-surgery diet. Okay. Also, the fiber from fruits and vegetables will help you have bowel movements seamlessly without you having to strain, because if you strain, that'll actually affect your incisions. And you also may be prescribed, I'm sure you'll be prescribed pain medication. For a major surgery like this, a mommy makeover, opioids are usually what's prescribed for pain management. And there are a number of different types of opioids, but they are known to cause constipation. All opioids cause constipation, which in turn will cause you to strain, which you should not be doing as a mommy makeover post-op patient. So you're going to want to make sure that you really are sticking to that diet, and so that you can move your bowels more freely and not have issues where you may have to put strain or additional pressure on your incisions. Okay. So there are a number of benefits as well as risks to a mommy makeover. The potential benefits are like firmer and flatter stomach and look, a more fit shape, improved breast shape, more proportionate body. But the procedure can also help things like reduce stretch marks, excess skin, and other benefits like that enhanced look. And also, it affects your attitude, right? Increasing your self confidence, your self esteem, your behavior overall. Now, the risks are too many to name. I feel like I would be in those pharmaceutical commercials. The possible risks of a mommy makeover are limited to, bleeding, infection, poor healing of incisions, loss of nipple sensation, fat necrosis. That's where you have your body, depending on where it is, it could be muscle tissue, nerves, can die, and it's called necrosis. But deep vein thrombosis, that's a blood clot, but it's typically in your legs. If that actually travels to your lungs, it could cause death. But you can have cardiac and pulmonary complications even if you don't have a history. And then you can have persistent pain. You can also come out with deformities from the procedure, honestly. And then anesthesia risks. So there's so many risks, guys. At the end of the day, the best you can do for yourself is to make sure you do proper research on the physician, on the procedure, on the facility where you're going to be doing it, and be very upfront and open about everything pertaining to your health and medical history and surgical history, okay? Plastic surgery should not be treated like a fast food drive-through. You owe it to yourself to take your time to research options that are best for you and your situation. This means you do your due diligence when researching the physicians, the facilities, and make sure, again, you're completely honest about your health history and you go through the full pre op exam with labs and you follow the post op recommendations to a T, especially with your recovery. And one more thing, try your best to have your full recovery with the physician that completed your surgery. It's best to have them follow your case from beginning to end for best results. Don't have it somewhere and then fly somewhere. I got to go back to work, and someone else is pulling out the drains and looking at your incisions. It's best to have them follow your case from beginning to end for the best results, okay, to keep you healthy. So I hope this was helpful. And until next time, guys, be well.